So I often see some men who are just unhappy with this area right underneath their neck. They call it their turkey gobbler, and they really feel uncomfortable with that. So they're not really interested in a big extravagant operation, but looking for something to eliminate that. And there is an operation that we can perform in the office, which we call a direct neck excision. And what we do is we actually take an ellipse of skin out beneath the neck and just tighten up that skin as well as the underlying muscle. This is an operation that we can perform in the office under a local anesthetic. It takes us about an hour. You go home that day, we put a little supportive wrap on that I'll have you wear as much as you can for that first week. And ultimately you wind up with a scar that goes kind of straight down here. But fortunately that scar typically heals really well. So these patients are back doing the activities that they want to do, certainly within 2 weeks. And then over the course of the next 6 or 8 weeks, that scar matures and it can become a lot more difficult to even see or perceive. This is an operation that has a lot of appeal, particularly for men who are much more willing to accept a more visible scar to directly address some of the issues that they have. There's no better operation than to directly excise something. That's where the power of this operation really lies. Anytime you make an incision in hair-bearing skin, there's always a chance that you could lose a little bit of hair. Most of the time that's temporary. Hair is very sensitive to any type of surgery that we do. But a lot of times over 9 to 12 months that hair will go back. There's always a small chance along that incision that you could lose a little bit of hair. So if you are very interested in maintaining a heavy beard, then you may lose a little bit of hair in that central area. But oftentimes this area is not well perceived just because their chin covers a lot of that, and certainly some of the shirts that they wear cover that. So that's not been a problem that I've seen in my experience, but it is something that you need to be aware of. So some patients ask, will the scar be noticeable? Well, anytime we have a scar, even a well-healed scar, if one looks closely enough, you can see it. For a lot of patients, this isn't a big deal, but for some it may be. There's ways that you can explain this. You know, you had to have a surgical procedure done. There's all sorts of things that are in the neck that potentially may have to be addressed. It just depends on how transparent you want to be with your colleagues. You know, clearly there'll be a contour change because you'll have a much sharper jawline. So that part will be perceptible, but that's really the intent of the procedure and why you're coming to see us anyway. So a direct neck excision really appeals to men. It's something we do in the office under a local anesthetic, and many of our patients are back playing golf and doing the things they want to do within 2 weeks.